And then your last name is pronounced Helman.
Yeah, like the mayonnaise, but I don't recommend mayonnaise. It's not a health promoting food.
No.
It's spelled differently than the mayonnaise, yes.
Okay, good. I make my own mayonnaise, actually. I use avocado oil and egg yolks, and it's actually quite healthy.
I don't think it's healthy, but we can talk about that if you want.
Oh, okay. If this whole thing turns into a debate about mayonnaise, then that's what it is.
Okay.
You're listening to the Holistic Nootropics Podcast, your home for holistic, evidence-based cognitive enhancement strategies. And now your host, Erik Levi.
Dr. Josh, welcome to the Holistic Nootropics Podcast.
Thanks, Erik. It's a pleasure to be here. Yeah.
So you have a very interesting background. You've studied at Harvard, you studied at Cambridge, and you've done a lot of work in several different fields of medicine, which we're going to talk a lot about on this podcast today. But I kind of wanted to start off with talking about your background in working with detox, specifically neurotoxicity. In the nootropic space, and really in the supplement space in general, it's really about constantly what can we add, right? It's like, what supplements can we take? What food can we eat? It always feels like we're trying to add more and more to it. But with detox, it's kind of about taking away. What do you think about that?
Yeah, I think you're right. I mean, if you look at the word detox, it seems like it's out of the Greek, removing toxins from your body. So that part makes sense. And yes, but I've got to say, so having been on both the traditional side of medicine and the more lifestyle or integrative approach, it's the whole concept of detoxification, unfortunately, is a little bit controversial. It's not controversial. So in my emergency medicine training, we were taught, if you take too much Tylenol, which is a potent toxin to your liver in high doses, that yes, we're going to give you a medicine to remove that toxin from you. So that part is not controversial. What is controversial is, I think, that you can change someone's, for example, neurologic problems by removing toxins from their body. So, and again, I think there are specific cases that are not controversial. I mean, if you're unfortunate enough to have brain damage from having very high lead levels because there's too much lead in your drinking water, then no, it's not controversial to remove those toxins using chelation or whatever you need to do if you have a very high level. But I think the controversy comes in where people have neurologic problems or other problems, and the simple ordinary test that their physician does comes back normal, and they say, oh, you know what, because you're acting weird, it has nothing to do with anything medical. It's all in your head. You've got a psychiatric problem. Here, take these medicines or get some counseling. And not that those things don't happen, but my concern is that we're missing many of these. We're attributing many of these neurologic problems or psychiatric problems to, just bad wiring in the brain, not toxins.
This is a thing I've been thinking a lot about, especially in relation to mental optimization and, kind of putting that up against the world we live in. You're talking about toxins, and the way that I got into being interested in health was, the idea of like mommy bloggers, and they're all talking about toxins, and it's all about like a juice fast or a this cleanse or that thing, and they sound great. But what I've discovered is that the idea of detox is so much more complicated than just, drinking the right juice or eating the right fruit or vegetable. I mean, there's a whole world of different mechanisms that go into the idea of detox. So maybe you can talk a little bit more about that.
I can try. I mean, I can tell you just from my background, 2 degrees in biochemistry, that the biochemistry, the chemistry of life is just extremely complicated. So, thinking back to all the different pathways, that there I learned from an early age that there are specific toxins. So, for example, lead, I just mentioned, lead can get in the way of your body's cells in the mitochondria producing energy. But I also understand from the standpoint, if you have someone out there saying, I'm just going to do this juice cleanse or juice detoxification, I'm just going to drink juice for the next day and remove those toxins, that may or may not work. I think the truthful part is I don't think we've studied that. Mm-hmm. In terms of, but I can tell you, having worked at Hippocrates, which is I was a medical director there a couple years ago, and it's a raw vegan retreat. And I can tell you that when people stopped eating their traditional Western food and started eating sprouts and raw vegetables, that their health improved, just like I've seen at TrueNorth, which is a fasting center in California. I've seen patients go, neurologic and other problems, those problems go away when they stop eating the traditional Western diet and either fast or just eat, fruits and vegetables and grains that are, cooked or raw. So, but part of it is, is it because they're eating these amazing vegetables that have nootropics and other great things in them? Yeah, that might be part of it. But I think just as important is they're not eating the garbage right. that are bearing them down, that have toxins in them. I mean, so.
Yeah. I mean, that's the crazy thing is we forget, just how toxic the environment is. I lived in New York City for years, and I just always knew as soon as I walked outside, I am breathing in, there are chemicals going in my body that the body has not, if we have 2 million-year-old bodies, the body just started getting used to whatever I'm breathing in. And so to think that there's a system set up to efficiently get all of this stuff out of me naturally, even if I'm eating, especially if I'm eating a Western diet, I'm gonna have some issues in my body and especially in my brain.
Definitely. And, just that raises two things I can think of. One is with this whole coronavirus, people are in quarantine and, there's not as much people driving, et cetera. Pollution levels have come way down in most cities. So people can actually see, hey, I can see the mountains from here now. Like I guess I was breathing that stuff, my whole life. That's number one. Number two, I think it's important to point out to people, Erik, I bet you know this. I don't know that many of all of your listeners know this, which is that within the last 100 years, we have these really smart organic chemists who invented like 100,000 different new chemicals that we call POPs, or persistent organic pollutants, that didn't exist before they were invented in a lab. And the thing is, not all of them, but some of them, let's say just 10% are toxic. Well, if you're releasing all these new chemicals that, sure, they some of them have great roles. We like the functionality of plastic. It's nice to have something that doesn't rip and tear and can contain things, but we don't like the downside, which is that many of the plastics are obesogens and cause people to gain weight. And, so it seems like we've done this big experiment over the last 100 years. And, you look around and you see the general public is becoming more and more overweight. And I don't think many people have connected the dots. Like, well, maybe it's because we're exposed to all these chemicals. And yeah, maybe it would be a good thing to remove the toxins from us. But, frankly, I think the first step is, for example, just don't, as much as you can avoid it, just don't use plastic in your life.
It's good. I definitely have noticed in the last few years, at least, that there has been more awareness raised around plastic. But then I also see the other side where a lot of companies are focusing more on specifically the polyphenol, the PCBs, polychlorinated biphenyls. Mm-hmm. But then there's other chemicals that go in the plastic that are just as toxic as PCBs, that they say, well, it's PCB free, but then there's these other things in there. So on the one hand, it's like we are paying for the convenience of something like plastic. But on the other hand, I think we definitely are underestimating how toxic on so many levels, things like plastic and even like building materials, like you look around your room, the paint in the walls, the glue on the floors, the glue in your furniture. And we're just constantly exposed to that stuff.
Yeah. So the example is BP BPA. Most people
BPA.
know it. Yeah, but PCBs are also toxic.
Right.
But people go to the store and they'll see a plastic bottle, and on it will say it's BPA free, which, hey, that's great. It doesn't have any BPA. It won't say, oh, by the way, this has BPS, which chemically almost looks identical to BPA, is just as toxic, but it's BPA free. So what I try to tell people is, just as much as possible, avoid plastics, because it's not just what the plastic is made out of, it's the accelerants they use in the manufacture process.
And it's pretty shocking, when you learn about how quickly something like those chemicals cross the blood-brain barrier, and the prevalence of these things in our world, and then you correlate that to the numbers of mental illness that you see, whether it's depression or even anxiety or ADHD. And, I don't think there's enough doctors, like someone like you, who understands these, who understands the body's role in detoxing and how these chemicals do affect the brain, versus a doctor who will very quickly say, okay, well, what you have is depression, or what you have is anxiety. Even more to the point, I think you have a lot of instances of people going to doctors and just flat out asking for these medications. And so there's just not enough education in this realm to begin with.
Right. And I think one of the other principles I try to communicate, it's the precautionary principle. Is like, when you have a new chemical, just presume that it might be toxic before you release it to the general public. Unfortunately, that was not done with a lot of these plastics that we're running into, and then once these get inside of us, most of them, the ones that are fat soluble, are not going anywhere. They're collecting within our brain and other fatty tissues. They might have a half-life of 70 years. For all intents and purposes, they're not going anywhere. But the saddest part is, but guess where they are going? They're going to the next generation.
Yeah.
If you check umbilical board, and they did this study at Harvard, my alma mater, years ago. If you check umbilical blood from newborn babies, they found a couple hundred different of these chemicals in these new babies, and many of those chemicals are toxic. And then we also know that the rate of obesity of 6-month-old babies has exploded, and you can't blame little babies for not exercising.
Well, they need to get into we could say they need to get to the gym a little bit. That's fine. We try not to be so politically correct here. No, you're right. That's frightening. When you see, and you can't blame the mother. You can't blame really anybody, because it's just, how do you, even the most health conscious person who stays up to date on, you cannot avoid plastic. You can't avoid, lead is everywhere. Some of these chemicals are just so ubiquitous in the world. And it's just shocking when you say something like doctors and scientists are finding these chemicals in umbilical cords of babies. That's the world that these kids are going to grow up in now, to see what this turns into 20, 30 years from now, to see if these kids are even able to procreate themselves, who knows? Yeah,
and it's not just in the babies; it's also in the water. If you're eating fish, the rates of PCBs in fish and other toxins like that have exploded. So that whereas fish 100 years ago may have been a healthy food, these days, the toxins accumulate the higher up you go in the food chain, on land or on sea, and some of these toxins are just very high levels in fish.
Right.
So which is why, but when I talk to people about this, I say, don't get depressed over this information. Just use it, and don't try to make a million changes all at once. Just maybe every week or every month, make one change. The fact that we're both drinking out of, stainless steel containers. How hard is it to use stainless steel instead of plastic? Simple changes that you can make. And that's the beauty of it, is as consumers, when we make decisions, financial decisions, the market will follow. So,
right.
Yes.
Yeah, I agree. And to kind of piggyback off that, I know you've done work with mold toxicity, and this is a thing that I'm just now starting to understand the depth of how serious this is. And I live in Puerto Rico, and there's hurricanes, there's rain, and it's been estimated that most of the cars have mold. We've found mold in our closet, and it just, you don't even notice it, but some people are so sensitive to it, and it just is hidden, and it does make a profound difference in a lot of people.
No question. A lot of these moldy toxins are they travel through the walls. So you may not see, mold in your wall, but if it's on the other side, the mold spores and the gas, the toxins they produce can go through. And so one thing that I want people to be aware of is if there's one room at home or work or in your car where you always feel sick after you're in that one place, start putting two and two together, as even though you don't see it, you could have a mold problem there. But again, this is an area which I don't think traditional medicine has caught up in general. So sure, there is recognition that there's something called aflatoxin in peanuts, and that's why people with aflatoxin get higher levels of cancer. Yes, that's been scientifically validated. Having said that, I don't see a lot of doctors saying, you know what, if you've got a choice of nuts, don't eat peanuts. I don't see that, but to me, that's a logical decision. Is like, maybe peanuts aren't your first choice, even though they're inexpensive. Maybe that shouldn't be your first choice of nuts.
Yeah. But I mean, there's a lot of different foods I'm finding that have issues with mold. I mean, really all the nuts seem to have some kind of issue. Walnuts, pecans, almonds, but then even fruits, grow mold, vegetables grow mold, and, different meats and cheeses grow mold. So it's really, and then, you can control it when you're at home, but then when you go out to eat, or if you pick something up, who knows what the mold profile of the food you're eating is.
Right. And the first thing is that I don't want to scare people. I mean, if you're feeling good and have no symptoms, I wouldn't lose a lot of sleep over this. But if you're having chronic neurologic or other issues, it's up to you to try to connect the dots. Don't wait for your doctor to figure this one out.
Yeah. Yeah. And that is, to me, I don't want to blame doctors for, there's a certain circumstance right now where it's doctors who have limited time with a patient, and, patients need an answer. And I would imagine patients are very demanding. You're spending a lot of money to see a doctor. You need to walk out with something, but the quickness that doctors will jump to give, an antidepressant or a stimulant for something like ADHD, when there are factors like mold toxicity and chemical toxicity that could be playing a factor in that maybe, mold's not like an easy thing to get rid of if it's in your house, but maybe if you become aware and mindful and kind of do your own experiments. To me, this is the kind of self-awareness that we need to start having for our own health.
Yes, and I think it's important to emphasize that it may take your doctor, if they're aware of this, time. You mentioned we met at this Great Plains conference. I mean, even if you send your urine, etc., to get tested for mold, it may take many weeks until those results come back. So yeah, this like, I want my answer right now, etc. It's like, yeah, you've got to do your own homework, and I feel like I've got a leg up of most physicians because I have these 2 degrees in biochemistry. I've been really interested in this stuff. I know that many of the mold toxins are fatty. I know that some of them, like, I don't know if you've heard of like the trichothecenes, they can actually travel through your eyes back into your brain that way, through the fatty gas. Yeah, literally. Wow. You don't have to worry about eating nuts. I mean, which is why mold, and I find people who are mold sensitive, they know. It's like if you go to a hotel room, you go into the bathroom, you're like, ooh, I can't stay here.
Yeah.
There's mold here. So trust your instinct. I mean, yeah.
So that's so interesting, because you're right. It's not just the food. It's not just the stuff. It's just your environment sometimes. Which kind of goes back to the whole detoxing thing. Once you discover, okay, I've been exposed to mold, or I've been exposed to plastics, or I've been exposed to lead. What do you do at that point? Where do you turn? Do you do a juice cleanse? I know glutathione for some people is effective, but for some people that's not a great way to go. Is it liver? Are you doing coffee enemas? I mean, what do you think is a good place to start for somebody who says, okay, I've got the mold, I've got the chemicals, how do I get this stuff out of me now?
So just to be clear, this is someone who also has symptoms. They have headaches, or there's some type. I think the logical place is actually to do testing. Mm-hmm. send off their urine, see if they've got these molds, see if they have these plastics in their system. And then when you know what you're treating, then you can go down the specific pathway, because different toxins have different treatments.
Right.
Now, having said that, if they want to say, I'm going to stop eating all this processed foods that are not, that our bodies were not designed to have, these foods that are high in salt, oil, and sugar, yes, definitely get those out of your life and start eating whole plants, fruits, vegetables, and grains. Sure. I mean, you're more likely going to feel better. And sure, you don't need tests to make that change. But if you specifically want to detox and remove specific toxins, I think logically it makes sense to know what toxins, you're actually treating.
So, okay, so let's kind of move into the diet side of this then, because I know you've done a lot of work with the plant-based diets. You've done work with the TrueNorth facility, doing a lot of fastings and fasting mimicking diets. How do you find that the success rate with doing a fast for like a detox type scenario, or is fasting not good for a detox type situation?
Yeah. So this is opinion. Let me just be clear. My opinion is that fasting is a great way to remove toxins, but I'm just sharing with you that is an opinion because we don't have a lot of scientific data that shows that when you fast, you're actually, removing a lot of toxins. I'm pushing TrueNorth to say, let's actually study this. Let's measure toxin levels when people are fasted versus not fasting. And I'll also say that, when it comes to juice fasting or water fasting, that's not something you want to do on your own, unsupervised for a long period of time. Just because there can be side effects just from that. But, in terms of, if you want to try eating one meal a day on your own, as long as you're not a brittle diabetic, yeah, I think that would be reasonable. But I'll share with you, I'm a little bit frustrated that I can't share with you. I mean, there's from a few years ago, there's a study that was done in Egypt, looking at the removal of toxins during Ramadan. So far I've only been able to get the abstract of that study. But in terms of, I mean, we're talking about something very basic here. And to my mind, there aren't good studies yet showing that what I'm saying, that my opinion is true. So that's a frustration on my end, that we're talking about something very basic, but we don't have the science to back us up. Does that make sense?
It makes sense because I feel like I've heard about science with fasting, because I feel like fasting has become very popular in the last, or maybe even mainstream in really the last couple years. I've done a 7-day water fast myself. And I do pretty regular kind of time restricted 16/8, that sort of thing. But I've kind of pulled the gas off a little bit on that because, I find that it causes a little bit more stress in my body. And I find that, you have two camps. You have the fasting zealots, and then you have the people who would never fast. And then there's kind of this I go with the bio-individual idea that it really depends on your body. Like you said, it's a hard thing to just jump into if you've got blood sugar issues. And there's a lot of people who really tout the benefits of fasting. I find there are benefits, but I don't feel like for me there are as many benefits as I was advertised to that there should be.
Right. So let me give you a specific example from myself. Last year, I did a 10-day water fast, and I was able to shave off 20% of my visceral fat. And the visceral fat is the fat that surrounds your organs, like your kidney and your liver and your heart. And it's also the fat that causes the inflammation, a lot of the bad things. And guess what? After I did this 10-day water fast, I felt great. I mean, my blood pressure came down and I was rejuvenated. But, I think about what happened during those 10 days. I lost 20% of my visceral fat. Well, guess what? I bet you that many, because I'm 53 now, many of the toxins I've accumulated in the last 50 years have, some of those were stored in the fat within the visceral fat. And so if I got rid of 20% of that, those toxins went somewhere. They either went to other fat cells or they came out of the body. And so to me, that it makes sense that would be one way to detox it. So just because it makes sense, though, it doesn't mean it's been proven.
Were you doing any exercising while you did that fast? Any
No.
sweating or anything, or?
No. And in general, just to be clear, I do not recommend people exercise while they're water fasting, because if you do that, your body is going to, when you exercise, your body needs glucose rapidly. They're going to go after your muscle source. You're going to catabolize muscle. That's not what you normally want to do. But it's interesting from a biochemical standpoint. The biochemical changes when you fast are almost identical to when you exercise. So what I like people to do is either fast or exercise, just not both at the same time.
Yeah.
Although I think it's perfectly fine if you want to fast overnight and then exercise in the morning on an empty stomach. Yeah, that's fine. But not, do a 7-day water fast and lifting weights during it. Doesn't make any sense to me.
Yeah, because for a while I was into that, kind of doing the overnight fast and then working out fasted, and I noticed that the progress, I wasn't noticing the progress, and then I started hearing more about this kind of idea of your body being in a catabolic state versus an anabolic state, and fasting and working out together can kind of, two-time the catabolic state. So it almost adds more stress to the body, and that could not work out so well. But I know I've heard people who do that, and that's where they see their best gain. So I guess it's really just individual.
It is. I mean, I can tell you what I do personally. So for example, I worked out hard an hour this morning, and right before, I didn't, I had dinner last night at 5 p.m. Didn't eat until after my workout, except for right before I worked out, I did a supplement that I like called Cardio Miracle, and which it increases the amount of nitric oxide, and I find I get much better workouts. Nitric oxides increase the size of blood vessels. Mm-hmm. And I've seen myself and other people, their VO2 max increases, meaning they can produce more power. And if you can produce more power, you can have a better workout.
Gotcha.
So, and there's a little bit of sugar in the Cardio Miracle, but I just normally leave that on the bottom. So, we're talking about 10 calories, a minimal amount of calories before the workout.
Yeah. I want to actually kind of circle back to a thing we were talking about a little bit. You're talking about toxins getting stored in the fat tissue. So I'll admit, I'm not the foregone expert on, the science of fat, but I have looked into it a little bit. And from what I understand, fat sequesters toxins or chemicals out of the bloodstream, and fat kind of holds on to these toxins. I think is that true, or?
That's very true. And the more fat you have on your body, the more toxins that you can store. So it's very true.
So is that kind of like a feedback loop within itself, where, okay, maybe you're a skinny person, hypothetically, kind of extreme circumstance, but you're a skinny person, and then you're dealing with a lot of chemical exposure. Maybe you live in a very toxic place, and then you start noticing some weight gain, but you're not really doing anything different with your diet. Maybe you're eating food that might be heavily sprayed with glyphosate or has a lot of different chemicals on it. Maybe there's mold in your walls. Maybe there's a lot of chemicals in your home, whatever it is. Is it a stretch to say that the chemicals alone can add visceral fat to you? Or is it that if you already have visceral fat, that you're more likely to hold on to these chemicals versus a person who doesn't have as much visceral fat? Does that make sense?
It does, but I think the answer is both are possible, and I think both are very common. And I think one reason we're seeing such exponentially rates going up of obesity is the obesogens, for example, the BPAs and other fatty toxins that we're exposed to, the estrogen-like toxins that we're exposed to now from birth or before we're born. So I think that's why you're seeing this explosion in weight. And I don't think you can blame people. People have no say over what their mom exposed them to when they were in the womb.
Yeah.
And they're eating animal products, whether it's milk or meat, that by definition have high levels of estrogens. It's the estrogens or estrogen-like compounds in plastics, etc., that are, I think, one of the things driving obesity in this country.
That's a real interesting comment because, along with the toxins, these toxins, and then, I'm an omnivore, but I think there's a lot of meat and animal products sold in this country that come from the animal agriculture industry that, you're right, are loaded with, be it hormones, antibiotics, whatever chemicals are exposed, whatever plastics is packaged in. I mean, there's a lot going on there. But then, the other side of that you just mentioned is the estrogen. And I've heard of people being estrogen dominant. And we're talking about a very powerful hormone that obviously can affect the way your body works, but then also the way your brain works. So, if you have a disbalance of hormones in your body, you're going to see an obesity epidemic coincide with a mental health epidemic.
Exactly right. And there's studies showing that if you take someone on from a traditional American diet and you put them on just plants and cut out all the animal products, their rates of depression, anxiety, other within a few weeks or a month. So this is more than just a theoretical discussion. I'll also warn people that just because they may see their milk or meat advertised like, hormone free. No, it's not. They may not add extra like they do to 90% of this stuff, but by definition, if you're eating, mammalian flesh, it's got hormones in it like estrogen by definition.
So, okay. So let me ask you this then, because you live in this plant-based world. Are you fully vegan yourself, or are you?
I am. Yeah. And basically just so people understand why. Yeah. I totally understand the ethical standpoint, but for me, from a health perspective, I don't want the toxins. And they've done studies, comparing the vegans to the non-vegans, and the vegans have about 10 times lower levels of toxins, like the PCBs, et cetera. We talked about 10 times lower levels of fatty toxins than the people who eat animal products. So I don't want the toxins that go along with eating animal products.
Mm-hmm. So how do you feel then about, things like oxalates in different plant foods? Because I know, again, you use the organic acids test, and one of the markers there is the oxalic acid. And I've been studying oxalates a lot recently and trying to understand their role in everything. They play into kidney stones. They play, there's evidence they play into different mental disorders, autism. And they're very high in plant foods. So I'm wondering, if you have any ways of getting around that, or how you kind of work with that aspect.
Yeah, so I agree with you. Oxalates, oxalic acid with some people, can be a huge issue. I mean, just to go on the chemistry side just for a little bit, sure. Oxalic acid, has the lowest pKa. It is basically, one of the most acidic things your body is going to run into. It's a real issue. And like a lot of these things, what I say is, if you're having symptoms, why don't we find out? Why don't we take a look at your urine and look at your organic acids, including your oxalate level, your oxalic acid level. And if it's really high, then we could try to adjust your diet. But what I've found is with people who, there's no question there's oxalates in some types of plants, but that's not a reason not to eat plants. You can choose to eat a low oxalate diet, so fine, don't eat a lot of almonds, etc. But I don't normally recommend restricting oxalates in your diet until we've documented that that's an issue for you. Now, if we know that you personally, Erik, happen to form oxalate, crystals, and you've had kidney stones from it, then that's not that common. But in your case, then we would restrict, your oxalate intake. But to make a blanket recommendation that no one should eat fruits or vegetables that have oxalates, I just don't agree with it.
Sure. I mean, I understand it's a thing I've been dealing with a lot because, I personally have tested high for oxalates. I was a vegan for a couple years. And before that, more like, I've always been plant-based, by like not the vegan definition of it, but literally the base of my plate is plants, and then I have, sure, an animal product. But what I've noticed is that since I was a vegan, that, and I've heard this all across the board from people who follow plant-based diets, is that, you start dealing with these different conditions, and maybe there's people who do kind of more the junk food vegan route. But I think there are other side effects too that come with, completely getting rid of animal products in your diet.
Side effects like you'll lose weight and be less likely to get diabetes and hypertension. Sure, if you call that a side effect, yeah, I agree with you.
I believe okay, so we're talking about, I do a lot of work or study choline, for instance, and choline, omega-3s, you're going to get, and granted, I'm not by any means promoting the idea of animal agriculture. The animal products I eat come from farms that are within 50 miles of where I live. In fact, I often shake the hand of the person who grew my food, and I get a lot of plant stuff from them. But I think there's a lot to be said for, things like omega-3s, choline, good source of protein.
Let's talk about choline. So I think that, there's literature out there showing that people who take in choline, in their food, it actually causes the bacteria in your gut will transform it into a toxin, okay, called trimethylamine, TMA. The enzyme that does this is called TMAO, trimethylamine oxide. So if you're taking choline in your food or in a supplement form orally, that you are potentially taking something that's going to become toxic when it gets into your blood. So I am not, even though I see it, and I'm sure you've seen it, choline as a, something to promote brain health. I think that's something that's being pushed by the egg industry, etc. It's not something based on science. It's more marketing. That there aren't, many people out there that are deficient in this country on choline. And in fact, if you start trying to take extra of it, the same thing with cholesterol. Our bodies all make cholesterol. We don't need extra from animal products. And that's my opinion on that.
Sure. And as understood, I've read both sides of the arguments, and, what I always kind of default, my background is in nutrition, is that everybody has an individual need for different things. And I've worked with people who are coming right off the standard American diet, and I don't think a vegan diet is that bad of an idea for somebody like that, or a plant-based vegetarian diet, in any way that you can get whole foods, especially foods that are fresh, foods that are grown locally. I think that's the first place to start, whether it's whatever diet, vegan, keto, paleo, vegetarian, whatever it is. I think the food should be coming from a good source. Is it grown right? Is it grown without chemicals? When I was a vegan, I was eating a lot of fruits and vegetables that were grown in a farm where they sprayed, glyphosate, and my glyphosate test from Great Plains came back fairly well elevated, So it's kind of the same thing where it's like, well, I could eat a whole stalk of kale, but am I also taking in all of these chemicals that come in? I don't think there is a perfect food other than filtered water, let's say,
Right. Yeah. But I think if you happen to be, eat mainly plants, you should be eating, for example, flax seeds to make sure your omega-3s are there.
Sure. But don't oh, go ahead. I didn't mean to cut you off.
I was going to say, but the flip side is where I hear people out there promote, oh, no, you have to have lots of healthy fats. Otherwise, your brain's not going to work. No, because, I find in these healthy, or, people say, oh, I need to have enough fat in my diet. What happens, they end up getting a blockage of their carotid arteries and don't get enough blood to their brain. And, we see this in autopsies of people with dementia have much higher rates of blockage of their arteries in their brain than those who don't. So I think, again, this push to eat healthy fats, I don't think it's a healthy push.
So, and that's interesting you say that, because, I see a lot of these studies too that kind of talk about, fats and they're bad. But then when I actually look at some of the data, I don't have the exact study to quote you, but, when they study like a fat, I find in a lot of these studies, they'll call like corn oil a saturated fat. and they give, corn oil to rats, and they say, look, see, the corn oil caused a block artery. They go, the saturated fat, caused a block artery. And of course, I don't think anybody in a paleo world, definitely, or a keto world, would encourage anybody to use corn oil, canola oil, vegetable oil, any of that stuff. But on the other side, I mean, you have this whole, I think there's a lot of nuance there that kind of gets lost in the conversation, I guess is what I'm saying.
There's nuance, but there's also marketing too. So for example, coconut oil or coconuts are promoted as healthy oils, but unfortunately people who, eat, most of their diet is from coconuts get heart attacks and other problems because it's a saturated fat.
Yeah. So I'm curious then, because I'm also interested in the gallbladder. And I find, and in order to get the gallbladder to work, as far as I know, I mean, not the only way, but one of the best ways is with fat, because the fat triggers the production of cholecystokinin, and then that triggers the release of the gallbladder. So I know a lot of people who have a consequence of a low-fat diet is gallstones. So, and then cholecystokinin also is a kind of natural nootropic. Cholecystokinin, there's cholecystokinin receptors in the brain. So, is there another way, that somebody on a plant-based diet can produce cholecystokinin that you know of?
No, I haven't studied that specifically, but I can tell you what I have seen in that working in emergency rooms around the country for the last 20 years is normally when people come in with a gallbladder problem where they need their gallbladder out or they're having a gallbladder attack, it's not from eating plants, it's from eating a high-fat meal. And could there be some secondary gain from cholecystokinin? I guess theoretically there could be. But the risk of getting those gallstones traveling to your liver and causing liver blockage, I think is worse than any benefit of cholecystokinin. So what I'm basically saying is that when I see patients with an acute gallbladder attack, I basically say you've got a choice. You can either change your diet and cut out all the fat, eat plants instead, or you can go see a surgeon and get your gallbladder removed. And when your gallbladder is removed, it's not really going to be helping you much, unfortunately.
Sure. Interesting. So, one other thing I wanted to ask you about is longevity. I would imagine, working in a place like TrueNorth and working with things like the mitochondria, you've probably been in this field of longevity, and there's a lot of people talking about longevity now. So I'm wondering, kind of what your experience with all that is.
Sure. So, I can tell you, the discussions about longevity, I remember back, decades ago, some of the early animal studies specifically looking at calorie restriction, that if you want to take rodents or other animals and double their lives, you give them fewer calories. Now that sounds well and good, but how do you, as a human, if you say, I'm just going to eat half your meals, hunger normally takes it over. And what I found is eating plants instead of animal products, my calorie intake has come way down. And I'm doing, I guess if you want calorie restriction, I'm doing it that way. And I think, if you look at it, that life extension, that often vegans or people who eat plants and avoid the high calorie animal products are going to live a longer life for that very reason. Right.
So do you have any experience, with using something like NMN, with nicotinamide mononucleotide, I believe it's called, or any of these different longevity supplements? I believe people use like NRF2 enhancers and things like that.
Yeah, so I'm familiar with them, but I think instead of taking a supplement, I'm a much bigger proponent of fasting. Mm-hmm. When you fast, your body's naturally going to produce more growth hormone. Your insulin levels are going to come down. So yeah, I'm aware that there are products marketed as life extension products, but to me, that the most physiological way to do it is through exercise and medically supervised fasting.
Yeah, it makes sense. The body understands fasting before it understands an exogenous substance.
Yeah, and the tough thing with most supplements is it's like, great, so you understand one of the pathways or two of the pathways, But what you don't know is that there are also 200 other pathways that this is affecting. So, and the, I've got nothing against, promoting products, but the problem is sometimes people are promoting, you can make money selling a Nerf 2 supplement, telling you to go home and exercise or, eat one meal a day. There's no money in it. So that's why I think you hear a lot more about supplements.
Yeah. Well, it's funny because I kind of live in this biohacking world, and I know people that have hundreds of dollars a month of supplements, and many of them are longevity, and they're like, I'm taking this in the morning, I take this in the afternoon, I'm stacking different, 5 different nootropics, and I smoke cigarettes. So,
right.
But I think it all offsets each other, right? So it is funny how that all works.
Yeah.
Or doesn't work.
It doesn't work. And despite what you may have heard, alcohol is a toxin too.
Yeah.
The product of yeast. Yeah.
Right. Although,
despite what you see about the ads, yes, alcohol is not a nootropic, in my opinion.
Yeah. Well, nicotine actually technically is.
Right.
Because it has different action on the acetylcholine receptors in the brain, but then you play that game of, well, how do I safely get this nootropic? And then at some point you decide, is this nootropic good enough? Do I need it that bad? Or can I get this some other way?
Yeah, and it also promotes weight loss. Same thing with cocaine. You're going to lose weight if you take cocaine, and you might feel a lot of energy, but the long-term effects are not good.
Yeah. I think the other thing with the supplement industry is that, as opposed to something like fasting, because that's where I go first myself. That's really what this whole channel is about, is how can we do this? How can we do this without all of the supplements? It's like, I believe in supplements. I think they're great. I think most of them are crap, but I think that there is a lot of good products out there that do the thing they say they're going to do. But I believe that the best way to get there is to build your body in a way that the supplement is like the cherry on top, and it enhances the benefit that 98% of your body work is already done.
Yeah. And I think that goes back to, our bodies are really smart. I mean, they've evolved over millions of years. Normally the body knows what to do. And I think that's why fasting works so well. You're just saying, body, figure it out, just get rid of the broken muscle and let me build some new muscle. And,
absolutely.
In terms of, I'm not down on all supplements. I think most people in this country are unfortunately deficient in vitamin D and vitamin B12. You can check your levels, and if you're deficient, you should be supplementing. No question.
Yeah. I think, and when I say most supplements are crap, I mean, most supplement companies, when you actually really dive into the supplement industry, I mean, it's the Wild West, and there's just so much shenanigans and so many people making a quick buck off of stuff that is made really poorly, and the regulations of it are kind of wacky, where they evaluate the final product, but they don't evaluate the ingredients. So you can make this product and go, look, see, that's a vitamin D supplement, and somebody looks at it and says that's a vitamin D supplement. You get the third-party certification, but the ingredients that it was made with, they don't test that stuff, and that's where you hear stories about these materials coming out of China and coming out of India, and they're tainted with all of these different things. So, I'm always of the opinion of, do it like a fast or fasting or mixed fasting in, good nutrition, good movement, good breathing, and then the supplement, put that on top of it. And of course, if you have a B12 deficiency, of course you should take B12. That's a very hard nutrient to get, even if you're eating animal products. You need that. Many people are B12 deficient, and even vitamin D deficient.
because B12 is made basically by bacteria in the dirt, and we're no longer getting our water supplied from dirty ponds or pulling carrots out of the dirt and not clearing off the dirt. So, but I strongly recommend that if you are getting a supplement, make sure it's made from fruits and vegetables and normal products, as opposed to petroleum, where you're going to get many of the impurities that we're talking about that are toxic. And which is why I'm a big fan of Cardio Miracle. It's like, I know the guy who formulated it, put it together. It's certainly not the cheapest nitric oxide product out there, but it, he sources it from fruits and vegetables, which is the way to go, because that's what, historically, evolutionary, that's what our bodies are designed to deal with.
Yeah. Yeah, the body recognizes the plant-grown. I use plant-grown digestive enzymes, and then different magnesium mineral supplements I use are also plant-grown. So
Right.
Absolutely. Sometimes you got to pay more for better stuff.
It's true. Yeah, but you're exactly right. The industry, no, it's often about how can we maximize our profit here, not what's the best thing for the patient.
Yeah. Well, this has been great, Dr. Helman. I think we had a great conversation here. I think we've really hashed out a lot of different ideas pertaining to detox and pertaining to, living optimally through nutrition, or in the case of fasting, lack of nutrition. I think we had an interesting conversation, about plant-based versus standard Western diets with animals. And then, of course, the longevity factor is something that's so interesting. And really, I think in the end, getting your body working right, the mind-body connection, it's going to help you feel better, and it's going to help you live better ultimately.
Exactly. And I think this, Corona pandemic we're seeing, it's like, it's culling people who are not following that, whose health, they've already had chronic diseases, and they're more liable to get this virus. So yeah, it's scary times, but Erik, I really enjoyed this conversation.
Absolutely. So if there's somewhere that the listeners can find you, if they'd like to work with you, if they'd like to read more of your work and your history and things you've done, where could somebody find you online?
Yeah, the best place is just through my website, Dr. Josh, drjosh.com, drjosh.com.
Okay, great. Well, thank you so much for your time, Dr. Josh. This was a pleasure, and hopefully sometime we can do a part 2.
Yeah, that'd be awesome.
Thanks for listening. For more brain-boosting info, in-depth articles, and show notes, check out holisticnootropics.com.